Good afternoon, everyone.
Hello.
We're going to begin with Scott Isaacs from NBC 10. Governor, he says, what do you think if some mayors, like in Providence, do not want to begin reopening this weekend if you lift the stay-at-home order?
So it's a good question. It's a tough call. I'm in touch with the mayor of Providence constantly. Our teams are talking pretty much every day. On the one hand, I'd like to see uniformity across the state. It's a small state, and I think it creates confusion for the citizens of the state to have to be following different rules. So I'd like to see if we could get to a place where we get aligned. Having said that, we also know that this disease really does vary. I mean, you can see it even in the statistics on the screen. Providence and certain communities in Providence and certain neighborhoods in Providence have a very different picture than, westerly. So every mayor, like every public official, has to do what they think is the right thing to protect the people in their city. So the long-winded way of saying, if it comes to that, I'll respect it, but I'd like to try to work so we can speak from a unified place.
Alex Weldon of WPRO notes, reportedly, Rhode Island garden centers are using Massachusetts guidance for operations in lieu of an update from you. This is also their biggest selling week of the spring. Do you care to comment on this?
Yeah, that surprises me. DEM put out new guidance yesterday, Monday, and they've been providing new guidance. So I will triple check that that is the case. We absolutely want the garden centers to be in business and to be selling. So check out the DEM website, and I promise I'll check this afternoon.
Our next question is from Bill Bartholomew. This is for Dr. Alexander-Scott. When will you lift the referral requirement for testing sites, particularly in those communities where a sizable amount of people don't have a primary care doctor? Further, have you considered Dorca's offer to provide translation services at these sites?
Excellent questions. We are actively working on ways to adjust to the community's needs. We recognize that not everyone has a provider, and thanks to the advanced and accelerated work of the technology group, we are looking at how we can have the technology support our ability to make sure people with and without access to primary care providers can get tested and then hopefully get connected with a primary care provider as well. So we are actively working through that as we speak and look to have a tech-supported approach at being able to address that soon. We certainly recognize the importance of having translation services available. So we always value partners such as Dorcas and many others, and want to absolutely work with them and others within the communities to make sure that the services people need for each community are available to them, such as translation services. So that's the work that the governor referenced that we are moving and working very hard towards.
Our next question is from Alexander Leslie of WPRI Channel 12. What is the current status of the state's supply of PPE as we prepare to reopen the economy? Has the recent collaboration with other states to acquire gear have been more effective than without?
Well, that's a collaboration that I just announced on Sunday, so we're still figuring out exactly how to operationalize that, but I'm confident it will help us because it just makes sense to be working with other states instead of competing with other states. The supply is stable. Listen, it's not where I would like it to be. You still hear from certain nursing homes that are struggling, hospitals, still having to do a lot of conservation. So I hope it to be better as the supply opens up all around the country. But it is stable. We no longer have shortages. We are, by and large, able to meet the needs of all our healthcare providers, and now we are moving into a place where we want to be able to supply surgical masks for more of our allied health professionals as we start to let them to open up.
Our next question today is from Christian Winthrop from the Newport Buzz. I'm hearing from lots of seasonal residents who want to come home to Rhode Island. How long do you envision the mandatory 14-day quarantine to remain in effect?
So later this week, probably Thursday, I'm going to be addressing travel and new restrictions for phase 1 on what travel will look like. However, I anticipate that 14-day quarantine to remain in effect for phase 1, and it is in effect now. I realize it's an inconvenience. If you have a second home here, we would love for you to come here, but at this point in time, the 14-day quarantine, which means you just have to stay in your house, is in effect.
Ted Nisi from Channel 12 asks, with the scope of the state's unemployment fraud problem coming into focus as a significant issue, will you have the state pay for credit monitoring of those who've been victimized, maybe out of the $1.25 billion from the feds?
Yeah. So first of all, let me say it's not at all clear that it is a significant issue, or let me say we're still trying to get our arms around how significant it is. I mean, $1 of misuse of taxpayer money is a serious problem, but to answer your question, I would say we're still trying to get it to come into focus, and there's just a lot more that I need to know about it, the details of the situation, before I can answer your question around what we might do about it.
John DePietro asks, since golf courses are open, can golf driving ranges open on Saturday? Also, can you touch on the thoughtful video by Father Talon regarding the number of people allowed to attend a funeral compared to Massachusetts and Connecticut? Why is Rhode Island no more than 5 when Connecticut is 25?
Okay. We're going to be announcing, let me back up. So unlike a lot of states, I never closed golf courses. We have been allowing golf throughout. On phase 1, starting hopefully next week, there's going to be phase 1 guidance for golf courses. So if you could just hang on for a couple of days, DBR will be putting out new phase 1 guidance for golf courses, which will address driving ranges, carts, tee times, etc. So you'll know before Saturday. I'm sorry, I didn't see the video. The answer to why is Mass and Connecticut doing it differently, again, every governor is trying to do what we feel is in the best interest of the public health and safety of the people in our state. So, we're all doing our best. We're all a little bit different. I have been strongly advised, urged, pleaded by my public health advisors to keep it at 5, and so I've kept it at 5.
Bruce Newberry from WADK in Newport asks, what standards of cleaning or sanitizing are you considering for restaurants so they can make guests feel safe? Might there be state certification training such as tips or a food safety license? Procedures such as documenting cleaning procedures on a regular basis?
It's a good question. So let me give you a flavor for how we're thinking about it. In the new economy, there will be certain things that will be guidelines. And you started to see that yesterday. By putting out those pictures yesterday, I was hoping folks who own a retail shop could take a look at the pictures and have a guide of, what their new life is going to look like. And certain pieces will be the new law, right? Like making sure people don't come to work sick may be a requirement. Whether you do that by taking someone's temperature or just have a check log when they come in, that's the kind of thing we'll probably leave up to business. Same thing for cleaning. There'll be a certain amount of it which is compulsory, you have to do this, and then others of it, we're going to have to let businesses have some flexibility to figure out what's in the best interest of their, how they can practically comply with the law. So this is the work that we're doing right now, and later this week, restaurants I won't have guidance for this week because that's a phase 2 effort, but we will have clearer guidance in a day or two for retail and for offices and such, to answer questions exactly like that. But just so you understand, and if you're a business person out there, I'm trying to walk a balance between requiring what is necessary to keep your employees safe, give your employees confidence, and prevent the spread of the disease, and also give you some flexibility so you can effectively comply with the new law.
Amanda Milkovits of the Boston Globe notes White House guidelines recommend a drop in cases and symptoms for 14 days, but Rhode Island hasn't seen that. She questions, will you reopen anyway? Which guidelines have been met?
Yes. So as I said a week and a half ago, our guidelines here are going to be a decline or a plateau. And I do realize that that is different from what the White House said. Having said that, I just put the data out the other day. We're still learning about this virus. We could be in a plateau for an extended period of time, which means that we could be in a place where the spread of the disease, or what sometimes people call the R0, is at 1 or below 1. In other words, safe to reopen even though we're in a plateau. So every day, as I did this morning, I talk to hospitals, I consult with Dr. Nicole and her team, we look at the model, we talk to the experts, and I laid out 6 criteria. And, you know, one, as it relates to this, we have said that a 14-day plateau is acceptable. As for the other guidelines, I'll go through, if you want, I can go through one by one. You know, there's the PPE guideline. We have to have, you know, what we need is a number of days on hand. We have to have our testing in a place where it hits certain metrics. Everybody who has symptoms should be able to get a test within a day. We ought to be able to complete our contact tracing with 48 hours. We ought to be able to get to a hot spot to do testing within 4 hours. So that's the testing metrics. We have contact tracing metrics that I just explained. We have to be able to take care of the vulnerable. So we're going through an extensive checklist, and if the guidelines have been met, then we'll do the reopening, and if they haven't, then we won't.
Alan Gabberty from WBOB asks, yesterday there were reports of a helicopter hovering over a Pawtucket cemetery, presumably counting mourners at graveside services. Can you confirm this? And what surveillance technology is being used to monitor crowds? Will the governor relax crowd restrictions in Phase 1 regarding funerals?
I cannot confirm that because I am not aware of that. And crowd, I'm not sure. I'm not sure. We're still deciding the number of people that will be allowed to get together in a social gathering in Phase 1.
Our next question is from Richard Asanoff of Convergence RI. What are the biggest problems you see with the flow of information around what is happening with the response to the virus?
You know, I think there's a lot of there's a lot of fear-mongering happening. So that's a problem if it's based on poor information. On the flip side, there's a lot of misinformation flying around that, you know, this has all been a big overreaction and we can just go back to life as normal. So I think the best advice I have had for people is to tune in here, to follow what's on the CDC website, to follow what's on the Department of Health website, and just, you know, go to official sources to try to get your information versus all the stuff that might be flying around on social media. Having said all of that, things are changing. I mean, one of the things that makes this a hard crisis to lead through is we get different, you know, things change, and as conditions change, as information changes, as our knowledge of the virus changes, as therapeutics change, we need to change with it. So the best advice I can say is, like I said, stay tuned to kind of official sources and keep yourselves informed.
Ron St. Pierre from WHJJ has our last question today. Does Friday's executive order allow businesses to deny customers entry if they're not wearing face coverings, and does it apply to drive-through?
It will definitely apply to drive-through, certainly apply to drive-through, and we are still crafting the executive order. So to be crafted, which will be released Friday. Penalties, what will be the civil penalties? There'll be fines. We're figuring out exactly what, exactly who's excluded, as the doctor was explaining, what your question falls into the penalties. Again, I'm trying to strike a balance between you want compliance, you want everybody to do this, but you know, we don't want to be overly heavy-handed. Having said that, we want to get compliance. So it'll be online on Friday, but it will definitely apply to drive-thrus, and that's something where we're seeing a lot of problems. If you're in your car and you're leaning over to pay for your coffee or whatever, you're within 6 feet of that customer service representative, and it's really not fair to them if you don't have your mask on.
Thank you very much.
Thank you.